A 65-year-old couple retiring today will need approximately $330,000 just for healthcare costs in retirement. That is not a worst-case scenario. That is the average, and it does not even include long-term care. Healthcare is the single largest expense most retirees underestimate, and today we are going to break down every cost you need to plan for and the strategies to manage them. Welcome to the Retirement Classroom. If you are new here, we publish deep dive retirement education videos every week. Hit that subscribe button so you do not miss a single one. Before we get into the details, a quick note. This content is for educational purposes only and should not be considered individual financial guidance. Everyone's situation is different. Please consult with qualified financial professionals before making decisions. If you are looking to speak with a retirement professional about your unique situation, scan the QR code on screen or check the link in the description. Let us start with the current cost of Medicare in 2026. Medicare Part A, which covers hospital care, is premium-free for most people who have worked at least 40 quarters. But the deductibles are significant. The inpatient hospital deductible is $1,736 per benefit period. Skilled nursing facility care costs $217 per day for days 21 through 100. After day 100, Medicare pays nothing. Medicare Part B covers doctor visits, outpatient services, and preventive care. The standard monthly premium for 2026 is $202.90, up 9.7% from $185 in 2025. That is the first time Part B premiums have exceeded $200 per month. The annual deductible is $283, and after that you pay 20% coinsurance on most services. If your income triggers IRMA surcharges, your Part B premium can be as high as $689.90 per month. Medicare Part D covers prescription drugs. The average premium for 2026 is $34.50 per month, actually down from 2025. The maximum annual deductible is $615. The big improvement is the new $2,100 annual out-of-pocket cap on drug spending, which took effect in 2025. Before this cap, retirees in the coverage gap could face thousands of dollars in drug costs. Now here is what catches most people off guard: what Medicare does not cover. Original Medicare does not cover dental care, including cleanings, fillings, crowns, and dentures. It does not cover routine vision care, including eye exams, glasses, and contacts. It does not cover hearing aids, which can cost $4,000 to $6,000 per pair for prescription aids. And critically, Medicare does not cover long-term custodial care such as nursing homes and assisted living facilities. This means the $330,000 fidelity estimate does not include long-term care costs, which average $119,340 per year for a nursing home. If one spouse needs 3 years of nursing home care, that alone adds over $350,000. The true all-in health care cost for many couples can easily exceed $600,000. Let us compare your two main Medicare options. Original Medicare with a Medigap supplement gives you freedom to see any doctor who accepts Medicare nationwide. You pay the Part B premium of $202.90 plus a Medigap supplement averaging about $189 per month at age 65, plus a separate Part D prescription drug plan averaging $34.50. That totals roughly $426 per month. But your out-of-pocket costs are very predictable because Medigap covers most or all of the 20% coinsurance. Medicare Advantage or Part C bundles everything into one plan. The average premium is only $14 per month on top of Part B, and many plans charge zero additional premium. About 90% of Medicare Advantage plans include dental, vision, and hearing coverage. The trade-off is you are restricted to a network of providers, and the maximum out-of-pocket for in-network services is $9,250. Medicare Advantage tends to be cheaper when you are healthy, but can cost more if you need extensive medical care. Now let us talk about healthcare inflation, because this is what makes healthcare costs so dangerous for retirees. Medical inflation has been running at approximately 5.8% annually, more than double the general inflation rate of about 2.4%. Meanwhile, the 2026 Social Security cost of living adjustment was only 2.8%. This means healthcare costs are growing faster than your Social Security increases every single year. Research from Fidelity shows that healthcare costs consume approximately 84% of a couple's lifetime Social Security benefits. That bears repeating. 84% of your Social Security goes to healthcare. For retirees between 60 and 65 who are not yet eligible for Medicare, the healthcare bridge is one of the most expensive challenges. The Affordable Care Act marketplace is the most common option. ACA plans cannot deny you coverage for pre-existing conditions, and premium subsidies are available based on your modified adjusted gross income. However, enhanced subsidies that were available during the pandemic expired at the beginning of 2026, causing significant premium increases for many early retirees. Keeping your Magi below the subsidy thresholds is critical. Roth IRA withdrawals do not count toward MAGI, making them the best source of income during this period. COBRA coverage lets you continue your employer's plan for up to 18 months at the full cost, plus a 2% administrative fee. This can run $1,000 to $3,000 per month, but may be worth it if you have preferred doctors and ongoing treatments. A spouse's employer plan is often the best option if available. One of the most powerful but underutilized tools for retirement healthcare is the health savings account. In 2026, you can contribute $4,400 for individual coverage or $8,750 for family coverage, with an additional $1,000 catch-up if you are 55 or older. The HSA offers a triple tax advantage that no other account provides. Contributions are tax deductible, growth is tax-free, and withdrawals for qualified medical expenses are tax-free. Qualified medical expenses include Medicare premiums, dental care, vision care, hearing aids, and even long-term care insurance premiums. The optimal HSA strategy is to maximize contributions during your working years, invest the balance in growth funds rather than spending it on current medical expenses, and let it compound for decades. At retirement, you have a dedicated tax-free medical fund. After age 65, you can withdraw HSA money for any purpose, not just medical expenses. Non-medical withdrawals are taxed as ordinary income, similar to a traditional IRA, but without the 20% penalty. And unlike IRAs, HSAs have no required minimum distributions. For long-term care, the numbers are sobering. The national average for a shared room in a nursing home is $327 per day, or approximately $119,340 per year. Assisted living averages $6,200 per month, or $74,400 per year. Home care costs $20 to $40 per hour, which can add up to $48,000 to $96,000 per year for full-time care. Medicare does not cover custodial long-term care. Medicaid does, but only after you spend down your assets to approximately $2,000 with a 5-year look-back on asset transfers. Long-term care insurance, purchased between ages 60 and 65, typically costs $2,600 to $4,500 per year, depending on gender and coverage level. Hybrid life insurance policies with long-term care riders are an increasingly popular alternative that guarantees a benefit whether or not you need long-term care. Here are 8 strategies to reduce your healthcare costs in retirement. Strategy 1 is review your Medicare plan every year during open enrollment in October through December. Strategy 2 is optimize prescription drug costs by asking about generics using 90-day supplies and comparing Part D plans annually. Strategy 3 is use all free preventive care, including annual wellness visits, cancer screenings, and vaccinations that Medicare covers at 100%. Strategy 4 is maximize Medicare Advantage supplemental benefits if enrolled, including fitness programs, nutrition counseling, and over-the-counter health product allowances. Strategy 5 is fund your HSA aggressively before retirement and invest for growth. Strategy 6 is manage your income to avoid IRMAA surcharges, which can cost $2,000 to $8,000 per year in extra Medicare premiums. Strategy 7 is plan for long-term care early, whether through insurance, self-funding, or hybrid policies. Strategy 8 is coordinate healthcare spending with your tax strategy, using HSA funds first, then pre-tax retirement accounts for medical deductions. Here are the key takeaways. A 65-year-old couple needs approximately $330,000 for healthcare and retirement, excluding long-term care, Medicare. Part B premiums hit $202.90 per month in 2026, up 9.7%. Original Medicare does not cover dental, vision, hearing, or long-term care. Medical inflation at 5.8% is more than double the 2.8% COLA adjustment. The new Part D $2,100 out-of-pocket cap provides significant drug cost protection. HSAs offer triple tax advantages and are the best dedicated healthcare savings vehicle. Nursing home care averages $119,000 per year and is not covered by Medicare. Review your Medicare plan annually and manage income to avoid IRMAA surcharges. If this breakdown helped you understand healthcare costs in retirement, hit that subscribe button and turn on notifications so you do not miss our next deep dive. We publish new retirement education every week.
Hey, before you go, if you're serious about your retirement, we'd love to help. Scan the QR code on screen right now or visit the link in the description to book a completely free strategy session with a qualified professional. It only takes a couple minutes to fill out, and there's absolutely no obligation. Take the first step today. We'll see you in the next one.